Hello everyone. Welcome back to Nurse on the Move. Thank you all for watching this video and thank you all for subscribing to my channel. I'm Alicia, a travel nurse, and I just came back from Phoenix, Arizona. And when I tell y'all this was probably the worst travel assignment I've been on, this hospital sucks. And I'm gonna name drop this hospital at the end of the video. So be sure to stay tuned. Go ahead and get into it. So it was me and two other black nurses. We were the only black nurses on night shift in the unit, and all three of us were travelers. So it's kind of like a sprinkle of pepper in all the salt. Okay, that's what this hospital is. And I don't mind working with people who don't look like me. The only thing I do mind is not getting treated the same as other people. You know, I'm a travel nurse. I'm expected to float first. I'm expected to do these things, and I understand, and I'm okay with that. But getting treated disrespectfully or blatant mistreatment and inequality is something that I literally hate, and I would never support, whether it's me or somebody else. You know what I mean? So let me just get into this hospital. So within the first 2 weeks, the manager texted me along with the two other black travel nurses and said that we were being complained on, said that we were sleeping, going off the unit, not picking up call lights, not answering the phones. Now, mind you, I'm not a secretary, okay? So I'm not about to be the first one to pick up the phone. You know what I mean? Like, especially if this is a place that I just started working at. So these complaints were just false. Nobody on the unit had phones, so that shows you that the unit was very small and that we didn't need phones. So if I'm leaving the unit, I'm going to the bathroom, bruh. Like, it literally was like walking on eggshells being here. Every little thing, somebody had something to say. There was one particular situation towards the middle end of my contract where, you know, all travel nurses are the first to float. Understood, that's fine. But there was a Caucasian travel nurse who was next to float, and she didn't float. They floated me instead because they said that she was here yesterday. Okay, honestly, I don't care if somebody was there 5 days in a row. Like, if you're next to float, you're next to float. So, okay, that's cool. If that's the rules, then cool. Like, when it's my turn to float and I was here the day before, make sure y'all keep that same energy, right? So, of course, same thing happened to me. I was sent to float, but I was there the day before. So I was like, I thought that if you was here the day before, then you don't have to float. Oh, everybody's deaf now. Don't nobody hear me. So, you know, this was probably, I didn't have that much longer to go, so I was like, okay, I'm not gonna make a scene. I'm gonna go to float, but while I'm going, I'm gonna be messaging the manager because everybody's so quick to message the manager for all these small things that are completely unrelated to patient care. So I'm gonna email the manager. And her only response was, oh, I'll check on that. Never did she follow back up with me. Never did she, you know, talk to the people who floated me or anything. There's inequality going on between me as a travel nurse and this Caucasian travel nurse. Now, all travel nurses, all nurses should be treated equally, but I mean, at least travel nurses need to be treated equally. If you gotta float, you gotta float, you know? So that definitely, those situations definitely left a bad impression on me about this hospital. And that's not even mentioning the actual hospital. And that's not even mentioning the actual patient care. Let's get into the patient care. Okay, so as a nurse, you should be used to CAUTI prevention, CLABSI prevention, you know, preventing catheter-associated UTIs and preventing central line infections, correct? So these include things like Foley care, daily Foley care, you know, cleaning your Foley, perineal care, and changing central line dressings and putting the Curos caps on dressings. Things like that prevents the patient from getting an infection. And our main reason for our job is to be safe. Patient safety is our reason for the season, okay? So, moving on. This hospital has no streamline anything when it comes to CAUTI and CLABSI prevention. No daily CHG baths, no daily Foley care that needs to be documented and charted in the system. None of that. And that was very concerning to me, especially coming from the hospital that I did come from, which is very prestigious and on their P's and Q's. Honey, JCO just, I guess they missed this hospital for some reason. I don't know. Every time I come in this hospital, I go ahead and change all my tubing, all my lines, because they don't believe in using stickers. So I don't even know how long this tubing's been up. And honestly, y'all had me all the way messed up when y'all ain't treat me fairly. So yeah, I'm telling all about y'all's hospital. Y'all need help. Whew, they got me mad, y'all. This was a PCU floor and the ratio was 5-1. Now, I don't know any true PCU floors whose ratio is 5-1 because clearly that's not safe, right? 4-1 should be the standard for all PCU floors and all step down floors because it's kind of hard to give proper patient care when you're running around with 5 patients trying to give meds, make sure people stabilize. And I can't count on one finger how many times my patient has just completely changed, went into AFib, RVR, had something going on with them throughout the shift. And managing all that with 5 patients was so hard. So all these rooms are semi-private, which means there's 2 people to a room. There's not much privacy that a patient can get, when you have another person in the room. If somebody has to use the bedpan or the bedside commode and, it stinks, then that means that their neighbor is smelling it, gross. So it just kind of shows you how old and outdated this hospital is and some of the policies as well. So this hospital is actually a hospital of a bigger network, the Banner facility, the Banner, network, Banner Boswell to be specific. And it is in a retirement community. So a lot of my patients were 60 and older, came in for chest pain, shortness of breath. Some people needed chest tubes, and some people were there for a longer time because of, different comorbidities. But it actually was not a COVID floor, surprisingly, because I could have swore I was about to work COVID, but God saved me on that one. So this hospital cut our overtime. We all, people are coming from far and wide to go to Phoenix, Arizona. And within maybe halfway through, they cut all of our overtime. Not that they didn't need overtime, they just didn't want to pay us for the overtime. So you can imagine the frustration for someone coming, from out of town, thinking they're coming down here to make money, and their 36 hours is on their contract, and they think they're going to pick up shifts and work more, but they canceled everybody's overtime. So it's just what? Stay away from Banner Boswell Medical Center. So these are just a few things that made this travel assignment horrible for me. Getting treated unequal, not able to pick up shifts, 5-1 ratio, patient care wasn't where it needed to be in my eyes when it came to CAUTI, CLABSI prevention, people sharing rooms. You can't have it all, but you can at least make sure that you're comfortable when you're working in a different environment. In an unfamiliar environment, it's very important that you're comfortable and, you're able to work within your comfort zone and you're able to do your job accurately and safely. So with this travel assignment, I did go with ProLink, who has direct ties with this corporation. So I was not allowed to put in any overtime, or not overtime. I was not allowed to put in any shift requests off or days off. So yeah, I wouldn't recommend going back to this hospital. And if you have any questions or comments, I also wrote a blog about this hospital. So yeah, thank you all for watching my video. Please be sure to subscribe, comment, and like the video. I hope this helps you for your future travel endeavors. If you have any questions that you need to ask your recruiter, be sure to ask before you start your travel assignment. You know, we all have 1 or 2 bad assignments, which is very normal, but if you can prevent it from happening, try at least. But thanks for watching and stay tuned.